Follow your team anytime, anywhere with Contour TV and the Contour app from Cox. Plus, use the voice remote to search for games or record one that starts past bedtime. Because even a 24/7 fan's gotta sleep sometime. Learn more at cox.com/sports.
Let's listen in on a live, unscripted second grade Challenger School class. They're studying Charlotte's Web.
How would you describe Charlotte compared to Wilbur?
I would describe Charlotte as self-reliant. I would rather have a self-reliant friend because then they would want to work for things that they get and they would want to earn it instead of just having it given to them.
Those students are 7. Starting early and starting right makes a real difference. Learn more at challengerschool.com.
Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and tonight I am on with Dr. Millicent Ravello on a holiday Zoom call from Orange County to Los Angeles. How are you doing, Dr. Ravello?
I'm doing pretty good. How are you?
Not too bad. Enjoying the holiday season, and I understand that you had a very successful trip to see the family. All went well.
I did. I had about 4 days with my family in Louisiana, and then I hopped on a plane last night and did a big case today, and I'm right back in the saddle.
Yeah, you know, I just couldn't do that. I needed some time off.
It was rough. I'm not going to lie. It was a little rough.
I mean, I have literally been operating, and so have you, since the reopening in May of 2020.
Yes, nonstop.
Non-stop.
Yeah.
Right?
Right. I keep thinking there's going to be a break coming, but there isn't.
In fact, our break to the MCAS meeting in Paris is now put off till June.
I can't really even talk about that because I'm so upset. So we were supposed to go to a meeting in April of 2020 in Bergamo, and that was canceled. And then we were set up to go to this Paris meeting in January of 2021, and it was all signs go, and then Omicron. And now it's also canceled.
I mean, I get it. I understand, but I don't, because I also think that this Omicron thing is the last gasp of the coronavirus trying to grip our world. I think it's on its way out.
No, I agree. And I think most medical experts are sort of that vein as well. It just sucks. Like, it's really hard to plan travel, especially to Europe. And that's part of the reason that this MCAS meeting was canceled, is because it's an international meeting and so many countries are having issues right now with travel and restrictions, and it was not a good time for it. But yeah, I'm hoping that this is in fact its last gasp and we're gonna not hear anything more going forward.
I hope so too. But that's not what we're here to talk about tonight.
No, not at all. Not even
tonight
close.
We're here to talk about nutrition in the pre-op and post-operative periods of plastic surgery operations.
Yes, it seems like a rather dull topic, but I mean, it's actually something that I know both you and I get all the time. Like, patients ask me all the time, so what should I eat in preparation for surgery? What should I eat after surgery? Usually it's the family actually that asks, what should I feed them? Like, with the people that are taking care of them after surgery. But the patients in the pre-op always ask me, so should I eat anything special before surgery?
Yeah, I mean, that's the thing. It seems to be pretty straightforward, but at the same time, I guess it's not. And especially operation to operation, I do have recommendations for people.
Yeah, no, and you are correct. It does seem like it should be a fairly straightforward answer. But then once I start talking to them, I'm like, well, actually, maybe you should do this. Oh, well, you know what? Actually, maybe you should do this. So yeah, it deserves its own podcast.
So I think one of the ones that obviously something I do a lot is rhinoplasty. And I don't really have a whole lot of specific recommendations for that operations, in and of itself. Same with facelifting. The facial operations don't have a whole lot of do this or do that. What I would tell patients is the day before surgery, I wouldn't eat a lot of heavy foods. And I would say this for any operation.
Any surgery